Thank you for joining us today. I'd like to introduce our two experts, Dr. Farrah Munir, Director of Fetal Echocardiography at Mount Sinai South Nassau, and Dr. Carlos Montoya, Director of Pediatric Cardiology. Thank you both for joining us today. Welcome to both of you, and thank you. I think this is an important topic for all of our families in the community served by Mount Sinai South Nassau. And I'd like to thank you for coming here today just to talk a little bit about what each of you do and the different services we offer in our community.
Thanks for having us, Dana. I think this is a great opportunity for us to be able to talk to people about what we do as pediatric cardiologists, and especially for fetal echocardiography. I am the director of the fetal echo lab here at Mount Sinai South Nassau, and a lot of people ask me, what is a fetal echocardiogram and why do I need it to be done? So a fetal echocardiogram is an ultrasound of the baby's heart. So we specifically look at all the structures of the baby's heart, and we start this usually around 18 to 20 weeks of gestation. So a lot of mothers are referred to us for a wide list of indications, and those can include in vitro fertilization, twin gestation, gestational diabetes, hypertension, high family history of congenital heart disease. So there's a wide variety of things. A prime example of a diagnosis that we might follow a mom serially through her pregnancy is lupus, for example. So if you have lupus and positive antibodies, that can cross the placenta and affect the baby, specifically causing a heart rhythm issue. So we want to make sure that the heart rhythm of the baby is normal throughout pregnancy and even after pregnancy. And the nice thing here, since I've started, we've created a list of all the pregnant moms who are to deliver outside Nassau, and those babies then will be evaluated by the pediatricians and OBGYNs and have all testing done that I recommended from a cardiac standpoint. And this has really allowed us to have seamless communication and really provide the best patient care for our patients.
So if I'm a pregnant mom and I know that I have lupus, do I call up the hospital and say I want to be seen, or are these conversations I start initially with my OBGYN?
Absolutely. I would say start these conversations with your OBGYN. If you think that there's any family history or diagnoses that you may have that may require a fetal echocardiogram, the OBGYNs are fantastic about communicating with our office, calling me and setting up a referral so that our sonographer and I can do these together.
Now, Dr. Montoya, just explain a little bit about what you do as director of the pediatric cardiology program, and at what point do the patients seen by Dr. Munir become also patients of yours as they grow older?
Well, as you can tell, I do have a lot of gray hair. I've been doing this for over 35 years. I was director of pediatric cardiology at Winthrop Hospital, now NYU Winthrop Hospital, for over 30 years, and I have been here for the last 3 years. And it's certainly a pleasure working with Dr. Munir and with our senior echocardiographer, Megan Bartlett. I think we have a great team where we actually can provide care not only from the fetal, component, but after the patient is born, and continue to follow with us. Our affiliation with Mount Sinai gives us a very strong base where we can actually take care of the patient if need be, and it has a complex or severe congenital heart disease. Is referred for surgery and evaluation at Mount Sinai, and continue after their repair of surgery or intervention with us here locally without having to travel to the city. Mi nombre es Carlos Montoya. Soy un pediatra cardiólogo que tengo más de 35 años de experiencia en esta área. Fui el director de cardiología pediátrica al hospital Winthrop NYU, y tengo 3 años de estar trabajando en el hospital de Mount Sinai South Nassau. Mi socia es la doctora Munir. El área de experiencia de ella es ecocardiografía fetal, al mismo tiempo que tiene especial entrenamiento y tiene un programa para pacientes que tienen hipertensión y hiperlipidemia, que es cuando el colesterol está elevado. Estamos muy orgullosos del programa que estamos desarrollando y del aporte que tenemos con el hospital de Mount Sinai en la ciudad.
So Dr. Munir, we recently opened a preventative clinic to treat pediatric hyperlipidemia and hypertension. So do kids, I mean, people in our community have elementary school age kids. I don't think they would ever think that maybe my kid has high blood pressure. Does that really happen? And at what point is it a concern for the pediatrician?
Sure, this is a great question. Believe it or not, this is a real issue in the childhood population with high blood pressure and high cholesterol, especially obesity nowadays is becoming a very large problem, especially in the United States. So a lot of parents ask, do I really need to get screening for my child at such a young age? And the answer is yes. The American Academy of Pediatrics actually recommends screening for all children starting at the age of 9 for a cholesterol screen. So we do a fasting lipid profile is what it's called, and that way we can look at the cholesterol to see is it elevated at a young age, because studies have shown that you can build up plaque or fatty deposits in your vessels starting at a young age, even in your 20s, to be pretty significant. And so if we can capture these patients at a younger age and manage them early, it helps to decrease their risk factors for cardiovascular disease when they're adults. And so we do start therapy with medications if we need to manage high cholesterol, to manage high blood pressure, and we try our best to educate both families and the patient about heart-healthy lifestyles, including diet and exercise, so that the whole family can participate in these healthy activities and decrease their risk factors.
So once a pediatrician refers a patient that he think might be at risk over to you, Dr. Montoya, what are the kind of conversations that you have with the family? What kind of recommendations do we make so that they're not a child then going into an adult with more serious issues?
I think the most important part, and I think medicine still needs to be concentrating and taking a very good family history. I think sometimes we believe that test is the answer to do and give the parents the result of test, but everything starts with a good family history. Any family members who have had any cardiac events early in life. Unfortunately, sometimes we see patients who have a history of sudden death. So for many of the conditions that we actually treat, the most important part is to obtain a very, very detailed family history, and then decide what is the best test, what is the best management strategy. Patients who have no family history, there's always the possibility of developing, significant congenital heart disease presentation as a teenager or a young adult.
Dr. Munir, in our community, if I'm a mom and I see that my pediatrician says you should bring your son or daughter to go see a pediatric cardiologist, and I'm looking in our area, there are a lot of options. Mount Sinai South Nassau recently received the accreditation from the Intersocietal Accreditation Commission. Tell me a little bit about what that means and why that's an important distinction.
Yeah, we're super happy to say that we recently did get this accreditation by the Intersocietal Accreditation Commission, IAC, and that has allowed us to hold a certain standard of our echocardiographic images. So both for fetal echoes and for transthoracic or echoes on the chest for children and babies, we are now held to a standard nationally to say that we are doing our best to get quality imaging, to provide the best patient care that we can, and to look at the imaging together with other cardiologists and teams when we need advice. The wonderful thing is, because we are part of Mount Sinai, we can also discuss our complex patients with the imaging physicians at the main campus to get opinions, to refer for surgical repairs, and to be able to continue a seamless transition transition for these patients who get cared for in the city and both in Long Island.
Dr. Montoya, Mount Sinai South Nassau is part of the Mount Sinai Health System. We're their flagship Long Island hospital here. So just talk to us about what that means for our cardiology patients here on the South Shore.
I think the important point that Dr. Munir made is that we can provide from fetal life, since a mother has been, told that to obtain a pediatric fetal echocardiography consult. We can actually take care of that newborn, provided there are no severe cardiac issues, and follow them until they reach adult, life. And then we do have the capability of continue to work together with Mount Sinai to provide, if they have congenital heart disease, the expertise that they need.
So thank you everyone for joining us here today. I think this was a great conversation about the different services that we offer to our younger patients in pediatric and fetal cardiology. I just want to ask any final words, any final thoughts for our families out there?
Well, thank you for allowing us to have this forum and discussion with you, because I think a lot of families and pediatricians in the area have a lot of questions revolving around COVID care and also what our department can provide to them and their patients. And so I think the beautiful part about what I do with fetal echocardiography is being able to potentially diagnose a baby before they're born, be able to set them up at Mount Sinai with the appropriate surgeons and cardiology team to have the care that they need, and then also be able to continue following those patients as babies into teenage years and even adulthood. So it's a really beautiful setup that we have here. Dr. Montoya and I are able to share the experience of caring for our patients and following them long term. So if anyone ever has any questions about family history or care regarding a cardiac diagnosis, we're always here and happy to help.
Thank you. Dr. Montoya, what about you?
Well, I'm very proud of the care that we provide here. I think we can actually locally, manage patients that can be certainly taken care. We want to have a very close relationship with the pediatrician and with the family. When you are a pediatric cardiologist, you're not only taking care of the patient, but you're taking care of the family. A big component of what we do is like to reassure the families, specifically the children and teenagers, if they're completely normal, that this pandemic has created a lot of anxiety in our communities, and we want to make sure that they get the care they actually need, but at the same time reassurance that they can go back to their normal lifestyle.
Dr. Munir, Dr. Montoya, thank you so much for joining us today to talk about the new services we have here at Mount Sinai South Nassau.